Hey students, this is a new video in a series Heart Failure Part 1. So hope so all of you are doing well and meet you in a very next video, that is heart failure included topic. So basically what is heart failure, we will discuss basic mechanism and basic physiology of the heart failure, and what is preload, afterload, contractility, ejection fraction, what is the stroke volume, and what is the progressive, complex progressive, and what is a disorder. Actually I would like to tell about it, that what is a disorder, what is a disease. Firstly and foremost, we will like to tell what is a disorder, what is a disease. Actually disorder is a disarrangement or a disability in our body because of our mechanisms. It is not by any other particle, any foreign other particle, any other parasite or any other microorganism. So it is a disorder. While moving into that disease is caused by an external factor or external any microorganism or any any bacteria, any parasite, any virus, any protozoa. So actually it is a disorder and disease covered. So first of all, moving into the very first line, that is a heart failure. What is heart failure? Actually it defined it as that heart has failed to perform the assigned task. What is the assigned task of the heart? That it pumps blood to all over the body in all the blood vessels, so that it can reach the oxygen or any nutrients to that organ, so that it can be grow properly and can be act as a functional organ. So heart has failed to perform the assigned task. So moreover, we have heart. Actually this is the shape. Heart has elliptical shape. Actually heart has elliptical shape, this kind of shape of heart. Okay, so here is the superior and inferior vena cava, and then this is a roughly diagram of the heart. This is an aorta. It pumps blood to the upper region and then to the lower region of the body. This moves up to the upper thorax, upper region of the body. This moving into the lower region of the body. And then we have pulmonary veins. And so this is an atria, this is a ventricle. This is atria, this is ventricle. This is right atria, this is left atria. This is right ventricle, this is left ventricle. So basically if you can ponder about this situation, that the left ventricle have highest thickness because it have to pump blood more forcefully into the organs, and it can be acting against the gravitational force. So it have to be a proper and a magnificent force required that can pump blood in a very good manner. So it is an elliptical shape. It is covered, and heart has its base on upper side, and because it has to pump blood against the force of gravitation. So here comes a concept that every organ have a base at the lower side, but here in an opposite case, that heart has a base at the upper side because it has to work against the force of gravity. And the next we have apex on the lower side. If in a contrast to other organs, apex is on the upper side, while here the apex is on the lower side. Heart muscles are strong enough to pump blood in this morphology. So in this morphology, heart have a good benefit that it can pump blood against the gravity. Aorta arises from the base of the left ventricle. So here this is a ventricle. So from here arises the aorta. This is aorta, aortic arch. It here vagus nerves and then glossopharyngeal nerves are present. That are the 9 and 10 nerves numbered as. So aorta arises from the base of the left ventricle. Right atrium receives blood from the superior and inferior vena cava. As it is discussed that Here is a superior vena cava. This is inferior vena cava. It pumps blood from the upper body of the upper body, and it collects blood from the lower body. So upper superior vena cava, superior and inferior vena cava. So right atrium receives blood from the superior and inferior vena cava. Right and left ventricle receive blood from right and left veins carrying oxygenated blood. So here the right and left ventricles, these right and left ventricles actually receive blood from right and left pulmonary veins. Okay, so here is that some terminologies that should be discussed. What is the myocardium? So this is what is the myocardium. Myocardium is a middle layer. Actually there is an arrangement of that organ, that myocardium is a middle layer. So what is cardiac output? Moreover, what is cardiac output? Cardiac output is the multiplication or the product of, we can say product of stroke volume or the heart rate. What is the heart rate? Heart rate is actually a how many times the heart beats. Okay, stroke volume is amount of blood the heart pushes. Okay, the normal value is a 4 to 8 liters per minute. 4 to 8 liters per minute of the volume of the blood is pumped from the heart to various organs of the body. And next we have stroke volume. What is stroke volume? Volume of blood ejected by heart per beat. Per beat, how many blood is ejected? 60 ml. What is cardiac output? Cardiac output is actually multiplication, as we could discuss earlier. It is a multiplication of the stroke volume and heart rate. Stroke volume is 60 ml, and what is the heart rate? That is a rate of the beats the heart is doing per minute. That is an 80 beats per minute. So here comes the 4800 ml or 5 liters of the blood is pushed out from the blood to the various organs of the body. And then we have to discuss that what is a preload. Preload and afterload. Preload is actually amount of blood entering into the ventricle. Okay, amount of blood entering into the ventricle at the end of diastole. What is the diastole? Actually diastole, here if we see that if this fist is closed, so if this fist is closed, every vein collects blood and pushes it into the atria. So it is a filling of the blood. And when this fist is opened, so here the pushing of the atria and ventricles to move the blood out of the organs. So it is actually, this fist is closed, so it is a diastole. It is a resting phase, and if it is open, so it is a systole, means the vibration is happening here. And it is a diastole, start of firing of blood. Actually firing of blood, and it stops after maximum filling of the ventricles. When the ventricles are filled, what is diastole? I have discussed that what is diastole. What is diastole? And it stops after maximum filling of the ventricles. So what is afterload? Afterload, preload is the amount of the blood filled in the heart before the systole. Sorry for that. Before the systole. And what is afterload? Afterload is the blood that is retained in the heart after the blood is pumped, blood from the ventricles, means that the heart rate have been happening, heartbeat have been happened, so the remaining blood is the afterload. Amount of the blood remained in ventricles after the systole. Systole is the pushing of blood out of the organ, and the pressure created by it during systole in left ventricle is the afterload. So what is the afterload? It is the pressure created by during systole. What is the pressure created during systole? During systole is the afterload, and it puts pressure to pump blood against force of gravity. This is force of gravity, F is force of gravity. So it puts pressure to pump blood against force of gravity. It overcomes the resistance to pump blood upward. So actually it overcomes the resistance that it happening. So it should be overcome so that blood can be moved upward. It opens the valves. So it opens the valves and blood moves into the aorta. So here is the very valves present. So if this is very critical situation that I can also can't understand what is happening here. So basically try to understand, try to figure out that here the left ventricle pumps blood into the this valve, and then this valve puts the blood into the aorta, and further aorta have, for example this is aorta, have this three extensions. So it pumps blood into the upper region of the body, to the chest, to the brain, to the arms of the body. And then onto the next page, moving to the next page, we have, for this purpose the pressure should be small. If the pressure should be small, why they are saying so? If the pressure is small, that the blood have less ability to come back into the ventricle. If it is happening that blood is moving back into the ventricle, so it is a disorder. Okay, so afterload is directly proportional to cardiac workload. Means to say that if there is a good afterload, good amount of blood is remaining in the left ventricle after this beat is done, so means cardiac workload is very much higher. If cardiac workload is higher, the brain have to put a long pressure to perform its task, so it is quite difficult for it to do so. It increases hypertension and vasoconstriction, as includes that hypertension constricts the blood vessels, have the high pressure of the blood, so vasoconstrictions also, that veins are actually constricted and blood have to be more properly actually there is not proper pumping of the blood, and blood can be back into the ventricles. These are disorders. And contractility, contraction force is directly proportional to better ejection fraction, directly proportional to better stroke force. If the contraction force is better, means that blood is properly ejected, and then moreover we have better stroke volume. If it is a stroke, what is a stroke volume? Actually we have studied here, sorry for that. A stroke volume is the amount of blood pumped by the heart in a beat. So what is the ejection fraction? The last term we shall discontinue there, and then we shall move into the next video, so we can continue that heart failure part. Actually this is a pulmonary part I can return to that. So moving into the topic, ejection fraction. What is the ejection fraction? Ejection fraction is the fraction of the blood ejected by the ventricles relative to its end diastolic volume. Means to say that ejection fraction is the fraction of blood, how many amount of blood is ejected by the ventricle SV means stroke volume, EDV minus ESV. What is EDV? And diastolic volume and systolic volume. As we seen that diastolic is the filling of the blood into the organ, and then we have ESV. S means that it is a pushing of the blood, pumping of the blood of the organ, so relative to its end diastolic volume. Thus ejection fraction is equal to stroke volume divided by EDV is equal to EDV minus ESV. As we discussed earlier that SV is equal to EDV minus ESV, so divided by EDV. Here comes the ejection fraction. Actually moving to the next part, we will discuss the right heart failure reduce ejection fraction, and then for systolic heart failure reduce ejection fraction, or diastolic heart failure with preserved ejection fraction, where the ejection fraction is preserved, means that it is not any damage in the ejection fraction, while that in the systolic where there will be a reduced ejection fraction. Ejection fraction is actually 55 to 70% is a normal range of the ejection fraction. So if it zooms that EDV, if it end diastolic volume left in vein, means if a vein is pumped blood and 100 ml is the remaining blood, and then the systolic volume is 40 ml. So how we can calculate the stroke volume? Left in vein 100 ml. 100 ml will be subtracted from the end stroke volume, that is 40 ml. So here comes the 60 ml. Thanks for this video, hope you like it. So kindly like, comment and share, and do let me know what you think about this, and if you have any queries about that, kindly let me know in the comments. Thank you, see you in next video.